start. So good evening or afternoon or good morning to everyone virtually joining in here during this session. And welcome to tonight's event on the critical global health challenges in the age of COVID with Professor Richard Skolnik calling in, joining us here from New Mexico, the United States. So that's why we had to think about the good morning for the time difference. And my name is Peter Tau, and I am primarily a history student at the Erasmus University, but I'm also a board member at the Honors Association, which is hosting tonight's event on this very relevant topic. So yeah, I'll be facilitating and moderating tonight's discussion on this topic of global health. And I'm going to stop sharing my screen now so that we can just see each other. That might be a bit more interactive. So yeah, close the screen share. All right. So, well, because tonight's event is a public event, so there might also be people joining us who are not too familiar with our association. So allow me to briefly introduce it to you. So the Honors Association is the official study association at the Erasmus University. Oh, I see some more people in the waiting room. Julius, maybe if you can also admit people in the waiting room. Thank you. So yeah, the official study association at the Erasmus University. And this means that we are both an international and interdisciplinary association with students coming from all different faculties and disciplines at the Erasmus University. And one of our main goals is to really be a platform for both professional and academic development, which is why we've organized tonight's event on a very relevant but also complex topic. However, before we jump into the serious subject matter related to the topic of global health, I thought it might be a good idea to, well, especially because of this online environment, to see where everyone is calling in from. So we're going to do a quick Mentimeter to see where everyone is coming from. So I'm going to share my screen once again. And now you should all see a Mentimeter. And if you go to menti.com and use the code up there on the screen, you can send in where you are currently joining the session from. And then Richard Skolnik and I have some idea with where the audience is listening from. So I think you can now do it if you go to the website and put in the code. All right, or Rotterdam. All right, now we see some. All right. See a lot of Dutch cities. It's also Germany, Düsseldorf, Tunisia. All right, that's good to see. Leeds, Edam, Bucharest. All right, nice. Well, it's good to see that we have some international students joining in as well, as everyone is parted from each other because of the situation in Mumbai from India as well. It wasn't the. All right. Well, that's interesting to see. And of course, with Richard Skolnik from New Mexico in the US, and Rotterdam being the dominant city here for obvious reasons. And I'm also calling in or hosting from Rotterdam. All right, well, that's good to see. And well, then the next question relates to more of the subject matter of today, or at least if I can go to the next question. Yeah, so because today's topic is on the critical global health challenges, well, I thought it would be interesting to see what the participants think or believe are the critical global health challenges for the future generations, so that both Richard Skolnik and I have some idea for what the future generations think. Right. Climate change, global warming, zoonotic diseases, sustainability. Right, see some diverse answers. Equal access to healthcare, aging populations, digital information, capitalism and inequity. Yeah, I think we see many topics that might come up during the discussion that will start in a few minutes. I see some more answers coming in. All right, well, that's interesting to see, and I'm sure Richard Skolnik will take many of these topics into account during his talk. So now I'm going to stop sharing again and well, move on. So, well, as the title of the event already suggested, we are virtually gathered here tonight to talk about, well, the topic of global health and public health in the age of COVID-19. And here in the Netherlands, we have been stuck in our homes for the past few weeks as the COVID-19 situation prompted the Dutch government to install a second lockdown since the pandemic started here back in March 2020. However, while COVID-19 often, and understandably so, claims the headlines, there are also many other global health challenges and issues that will challenge the future generations, like, well, for example, other epidemic diseases, climate change related to public health threats, and the increase of non-communicable diseases or NCDs, as we've seen in the Mentimeter just now as well. But luckily, as I am far from an expert on this topic, which the public health and medicine students joining in might have noticed already, I will not be doing the talking because we are privileged and honored to be joined by global health expert Richard Skolnik. So allow me to briefly introduce him to you. So Richard Skolnik has more than 40 years of experience in international development and global health. He has spent 25 years at the World Bank, retiring as the Director for Health and Education in the South Asia region. And at the World Bank, Mr. Skolnik worked on education in West Africa, but also worked on health in the Middle East and North Africa region, Latin America and the Caribbean, as well as West Africa and South Asia. Mr. Skolnik's health efforts focused on health systems financing and development, improving equity, maternal and childbirth, and the control of communicable diseases. And after retiring from the World Bank, Mr. Skolnik was the director of the Center for Global Health at the George Washington University and served as the executive director of the Harvard PEPFAR for AIDS treatment in PEPFAR program for AIDS treatment in Botswana, Nigeria, and Tanzania. He then became lecturer at Yale University and recently retired from this position. And while engaged at George Washington University and Yale, Mr. Skolnik led 2 evaluations of the International AIDS Vaccine Initiative and an evaluation of the Global Leprosy Alliance. So all in all, Richard Skolnik is one of the subject matter experts on the topic of global health, and we are truly honored to have you here with us tonight. So just before we get into the subject matter, I would like to briefly outline the structure and some rules and formalities to make it as smooth as possible. So in a few minutes, I will give the floor to Mr. Skolnik, and he will share what he believes are the critical global health challenges for the future. Or in his words, the global health challenges that should keep the future generations up at night. And then we will open the floor to questions and comments and hopefully have a fruitful discussion. We highly encourage participants to join in this discussion by using the raise hand function in the participant section or by typing your question in the chat. And if you only want to type your question, that's totally fine. You can just type it in the chat and I will monitor and ask the questions on your behalf. But please refrain from using the chat too much for non-discussion related comments, because that limits my ability to well, monitor the questions. And you can also ask your question or comment yourself and interact in the discussion. To do this, use the raise hand function in the participant section. Then I can give you the floor to ask your question and to interact in a respectful manner. And lastly, in order to maximize the interaction, we would very much appreciate it if you could turn on your videos, which I already see a lot, which is nice to see, especially when asking a question, but of course, only if you feel comfortable doing so. And it's no problem if you don't, and you can still ask your question and interact. So yeah, raised hands take precedence over questions in the chat. And with that being said, I believe it's time for me to stop talking and get into the subject matter. So please, Mr. Skolnik, the floor is yours.
Great. Well, Peter, thank you very much. And thank you to all of you for joining us today. It's a real honor and privilege to speak with all of you. I have great affection for the Netherlands, but I've worked on 56 different countries in my relatively young life. And I've been in all of the countries which you seem to come, except I'm sorry to say Romania. But we had actually planned a trip to Romania. And then my son decided to read right on top of that trip, and we were never able to take it. So I'm grateful for the invitation. I'm honored by it. And I'm honored as well by the fact that we have such an interesting audience from so many different countries. If you want to, later you can ask, but some of the countries I've been to many times. I saw somebody was there from Mumbai, and I really have been in India 91 times, as I say, despite my relative youth. Peter's introduction was a very gracious one. I just want to correct one thing. somewhat teasingly and jokingly, Peter, so don't worry, don't take it seriously. Not so long ago, I gave a talk at Yale, and one of my friends there, who's a very distinguished professor of pediatric infectious diseases, introduced me as one of the leading authorities in the world on maternal and child health, about which I was going to speak. And Peter has kindly introduced me as a great expert. But my usual response to that is to say that I'm really not the leading expert on maternal and child health, nor on emerging and re-emerging infectious diseases, nor on antimicrobial resistance, nor really on any of the topics I'm going to discuss. But I usually say, pointing my finger, my friends really are the leading experts in the world on each of these topics. And my friends completely agree that I am the leading expert at summarizing the work of my friends. So I hope you'll find some of what I have to say is slightly thoughtful or slightly original, but mostly what I'm trying to do, of course, but now as a global health educator who practiced for so long, is try to bring information to the attention of relatively younger people as well as policymakers in a form that I hope you'll find easy to understand and easy to digest. Whenever I give a talk, I like to be clear about the goals of my efforts. I'm completely outcome oriented. I hope in your own work you'll be outcome oriented as well. And what I like to say is, I'd like to define my goal as how I would like the participants to be different when they leave than they were when they entered the talk. And in some respects, therefore, what I'd like to say today is that, I hope when I'm finished, and I hope when you turn off your computers, I hope that you'll be much more provoked, much more excited and agitated, and I'm sorry to say, much less likely to sleep at night than you are right now. That would be my goal, and it's against those three metrics, provocation, agitation, and sleeplessness, that I hope we can judge the extent to which I've honored the kind invitation that the association has given me. So I'm only going to speak for 30 minutes or so, and then we'll open it up for questions and for engaging with each other. I'm going to focus my remarks on what I call global health challenges in the age of COVID-19. In some respects, and again, I don't really want to make you sleepless, you could say, at least in the age of COVID-19, another title for the talk could be Global Health, What Should Keep You Awake at Night? I saw the thoughtful comments that you made on topics that you think are critical, and I agree that all of them are. In my initial remarks, I'm going to focus mostly on items that I think are quite immediate and that have been made more immediate because of COVID-19. But then in light of what you've said, I'll make some additional comments about the medium run. And I'm sure in our questions and answers, we can talk about much more. I'm also going to start by focusing on the virus itself, which I'm sure everybody's very tired of, but I hope I can nonetheless add some value. I also want to remind you that I have a great preference for substance over process. There are important process issues that relate to global health, and we'll talk about them. But I'm going to focus first and foremost on substantive issues, and then only at the end of my remarks talk about some of the process issues. The last thing I'll say in an introductory form is, for those of you who have met me before, I have the reputation for being a pretty funny guy, as we say in American English. I have the reputation for being a global health practitioner and global health educator who should have made his career in comedy instead. Unfortunately, the organizers have asked me to comment on matters that are rather more serious. On another occasion, Peter, perhaps you can invite me and I can do stand-up comedy for you. But today is certainly not going to be one of those occasions. Today, these remarks are basically going to be very serious, and of course, sometimes deadly serious. So let's talk about then what are these challenges? Again, most immediate and most related to the age of COVID as I see them. Well, the first and most obvious one is getting COVID under control. And that means getting COVID under control, not in Tunisia, not in India, not in the Netherlands, not in the UK, not in the United States. It really means getting COVID under control everywhere. My textbook has right up front the line that says, the health of anyone, anywhere, is the health of everyone, everywhere. And I know that all of you believe that or you wouldn't be here, but COVID certainly highlights that. And I think a number of countries, a number of leaders, many people are kidding themselves if they believe that it's okay to try to suppress COVID in your own country, even if there continues to be COVID in the Democratic Republic of Congo, or in South Africa, or in Guatemala or Honduras. So we need to get COVID under control, and we need to get COVID under control everywhere, because no country can be safe as long as the virus is circulating anywhere else. It's not, in that respect, it's not that different from polio. In addition, of course, and another reason why this is so urgent is because we know that the social, educational, and economic consequences of COVID are immeasurable. And despite the fact that so many people failed to see this originally, and I think some people failed to see it now, we're not going to return to normal life. We're not going to stop these hemorrhage in education, in society, in the economy, unless the pandemic is brought under control. This is a global crisis. It's an economic crisis. It's a social crisis. It's a psychological crisis. It's an educational crisis. Its origins are public health. And everybody has to understand this. And I think, again, anyone suggesting that paying people for not working, or fiscal stimuli, as we're talking about in the United States, or maybe sending the kids in a hybrid model, these are small bandages that can't come close to addressing the real problem. And we can't go back to anything like normal life until the virus is brought under control. Now, there are countries, and I think they're not represented here, such as Australia, New Zealand, South Korea, Taiwan, Thailand, and Vietnam, which hopefully will be able to, and I should say China too, which hopefully will continue to be able to suppress the virus. And hopefully they'll be able to continue to suppress the virus even better with the help of vaccines. But in most countries, the virus is so far advanced over our efforts and so easily transmissible, and has infected so many people and is infecting so many more people, that it's hard to imagine how the virus can be contained unless we have urgent and massive efforts to vaccinate everybody. And that really means basically everybody on the planet, or as you know, maybe 90% of the planet if you can really achieve herd immunity. The good part is there's been, as you know, an enormous amount of progress in the development of vaccines, with, depending on the country, as many as 4 vaccines that have been approved someplace: Pfizer, Moderna, Sinovac, and AstraZeneca. But the bad news is trying to suppress the virus, even with these vaccines, will face some enormous challenges, and let me just raise them one after the other. One is population fatigue of public health measures. To my shock and horror, I saw that even in the Netherlands yesterday, there was a protest against mask wearing and the public health measures needed to address the virus. 2 is there's the challenge of new variants of the virus that may make it more transmissible, like the variant in the UK. Three, and much more worrisome, is the possibility of new variants of the virus that may not be as susceptible or may not even be susceptible to the vaccines. And certainly right now, everybody's very worried that the South Africa variant might fit in that category. And then, there are many steps from the time they invent a vaccine until it goes into your arm. And there are huge issues with these vaccines, of course, in manufacturing, storing, and distributing the vaccines from the plant, into your arm. As you know, two of the vaccines have to be kept very cold, and one of them unbelievably cold, which makes that vaccine almost useless in low and some of the middle-income countries. Two is, I don't know how much you know about vaccine manufacturing, but it's sticky. It's not very elastic. And if you want to make more paracetamol, you could probably set up a factory in a few days. If you want to make more vaccines, you can't do that. It's vaccine capacity is quite inelastic. They've gotten a head start, but to go from 200 or 300 million doses to 14, 15, 16 billion doses is an enormous challenge. And then just moving this stuff around from one place to another. I like to tease my Dutch friends with deep affection by saying, this is a picture of Holland actual size. It's about 2 kilometers by 2 kilometers, and that's the whole country, despite how charming it is. And of course, an important part of that is grachts, at least, on which you could move vaccines if you wanted to, right? But, I live in a state that has only 2 million people, but it's 600 kilometers this way and it's 600 kilometers this way, and I've worked on Nigeria and I've worked on India and I've worked on Pakistan. And I don't need to tell you what an enormous challenge it will be, even if they ask Coca-Cola or DHL or FedEx or UPS to assist them in moving the drugs around. Then there's the problem of vaccine hesitancy, which in some respects is worse, because not only do we have the normal vaccine hesitancy, but now we have people in different countries who think, bizarrely, that the virus has come from 5G cell phone towers, or that the vaccine is part of an international plot led by Bill Gates and his friends to make money. In addition to the normal thing, which is the vaccine is made by a majority community, which will be injected into a minority community, which will sterilize that minority community and keep them from moving forward. Then another one, of course, is we know that children tend not to get as sick unless they rarely get multi-system inflammatory syndrome, God forbid. But we know that kids get infected and we know they spread. And yet the closest we're coming so far to a vaccine for little kids is, the testing of vaccines. I can't remember if it's 12 and above or 16 and above, which is good. But right now, so far as I know, there's no place in the world where clinical trials are underway to vaccinate young children. And yet they're an important reservoir of potential spread of the virus. So again, my aim is not really to keep you up at night, but I think we need to face realistically the challenges that trying to overcome COVID will face, with the easiest challenges in places that enacted public health measures in consensual ways, using science, and acted as if their life depended on it, and which can benefit from the vaccine. But practically everybody else, certainly in the high-income countries, some of the low and middle-income countries, and maybe the rest later, where all of these will have to be put together in effective, efficient, safe, and fair ways if the world's going to be a better place. Then I would say the second challenge right now is overcoming what I would call the indirect losses and the after effects of COVID. And this, at first, I started telling myself that this might be more important in low and middle income countries than in high income countries, but it's going to be true everywhere. It might manifest, these after effects and indirect effects will manifest themselves in different ways or at different levels of magnitude, but they're going to be important throughout the world. And let me just name a few of them. The first is going to be crude, dead healthcare personnel. In every country in the world, healthcare personnel themselves have been infected by this virus and have died from it, sometimes in quite substantial numbers. It's good that they are first in most places for being vaccinated, but the number of healthcare personnel who have succumbed to COVID in some places has been astronomical and has really made a dent. And if that happens in low and lower middle income countries, which are already very short of healthcare personnel, and it happens at a time when there continue to be waves of people moving to the hospitals because of the spread of the virus, this is just going to get worse and worse and worse. Two is, on hospitals throughout the world has been enormous. In countries that have social insurance systems like most of yours, those hospitals will survive. They've lost some revenue, but nothing like the revenue lost in places without social. So my son is a physician, for example, at the Mayo Clinic, a very famous hospital in the United States, supposed to be one of the best in the whole world. You can imagine their revenue comes not from social insurance schemes, but partly from doing surgeries and taking care of sick people. But COVID has displaced a huge share of their work. So I read some months ago, for example, that places like the big hospital enterprises in the United States, like Mayo, like Mass General Hospital, the Harvard hospitals, and a few others, they were on track in 2020 to lose $1 billion. Now, a big hospital group like that can lose $1 billion, but the smaller hospitals in countries without social health insurance, which depend on fees or other private insurance, they can't do that. And so what you're seeing in a number of countries is hospitals which are running a deficit, which can't go on. They're closing part of their hospital. They're laying off staff at a time when most of these places are desperately, desperately needed. Then, of course, there's a huge share of patients who need care, but whose care has been postponed. I have a examination coming up for my one chronic condition, and I was discussing with my son today whether or not I should go get this examination done. I'm 3 months overdue, but we agree that the risks of getting this exam are still greater than the benefits, even though they have to go into my stomach because I bled many years ago and be sure I don't have cancerous cells in my stomach. But I'm in much better position than people who have care for diabetes that they postponed or they couldn't get to, care for cardiovascular diseases, which they couldn't get to, care for hypertension, which they couldn't get to. And in much of the world, what we're looking at is people who couldn't get care because they were afraid, the hospitals told them to stay away, or the healthcare providers told them to stay away, et cetera. I'm sure all of you have read about people who died at home, even of heart attacks, because they were afraid to go to a healthcare facility or felt that it was too difficult to get there. Every one of you will understand the enormous impact of the pandemic on mental health. It's hard to measure, although we are seeing in many places an increase in substance abuse, an increase in alcohol abuse, an increase in physical abuse, an increase in child abuse, an increase in depression, an increase in suicide. So, and this isn't going to stop anytime soon, I'm sorry to say. So I think, and I'll come back to that one. Oral health. So the best of, in high income countries, people get their teeth attended to mostly. In low and middle income countries, that's much less true. If people are dying at home because of heart attacks, imagine the extent to which people are putting off care for their teeth, which we know not only affects your teeth, but oral health is probably when you put it all together, the new burden of disease study will say it's probably 10th in the risk factors for ill health. And certainly the people I know are basically just forgetting whenever they possibly can any healthcare appointments because of the fear that the healthcare setting itself will be one that poses risks of exposure to the virus. And lastly, when we look forward, the economic consequences of this are horrific. The Dutch, the Brits, the Germans, the French, the Americans, hopefully, we will probably have the resources to overcome this. But my friends in Liberia do not. My friends in Guatemala may not. My friends in Burkina Faso, Mali, Niger, Democratic Republic of the Congo, Uganda, Burundi, Malawi, they don't have the money they need to carry out normal governmental affairs. And their budgets have taken an enormous hit from COVID. And I think we really have to worry, of course, about the lack of future financing, which mistakenly often gets taken out on the health sector, as you know. In many countries, until very recently, when they fall into deficit, they take it out on civil service employees. So let me come back then to a couple of other things and say a few more words about mental health costs. Some people are calling mental health the fourth wave of COVID. Again, it's not always easy to measure this, but I've already mentioned some of the areas in which we know COVID has had a big impact on mental health everywhere. It's everywhere. My granddaughter is the happiest little kid in the world. I don't need to tell you she's the cutest 5-year-old granddaughter in the world. I'm sure you already know that. You will be amused to know she speaks more than grandpa, which is unimaginable. But this kid who's got mommy and daddy and brother and grandpa and grandma just down the street, and we're only seeing them outside, even she begins speaking by saying, grandpa, when the virus goes away, maybe I can see my friend on. Grandpa, maybe when the virus goes away, I can play with Anna again. And this kid is as well balanced, as happy as any in the world. And yet, it's the knowledge of what's going on is unavoidable. She's going to 2 preschools online and begins each of her expressions with, I'm really hoping when the virus goes away, I can play with my friends. The kid for 1 year, we're going on 1 year, has not played with or been closer than 10 feet to any of her friends. And this is a kid in a privileged society with a privileged life who doesn't make her own toys and knows where every meal will come from. Actually, the answer to where every meal will come from is grandma, but her life is good. Now multiply this by 5,000 times for kids who don't know where their next meal is coming from. And many of them are in my own country. The state in which I live has the heaviest share of Native Americans outside of Alaska. I think 9% of our state is Native Americans. There's a high level of poverty among them. A third of our Native Americans don't even have safe drinking water in their home. And you can imagine the burden, and they all have to work out, and not many of them have a choice of working at home. So what we're looking at is, the mental health impact of losing your job, losing your income, being isolated, not going to school, and the inability of kids in many places just to be children, which we know is incredibly important to their well-being. To compound this, I think we can say, look, when you look around the world as a whole, there are very few countries that do a good job of handling mental health. The Norwegians might do that. The Dutch have their famous dementia homes and are much more humane and compassionate than my own country. In America, you see homeless people, you see a large share of mental health people in jails because that's where they can get care, or you see them as homeless because they're not getting anything like the care or the help that they need. If mental health is highly stigmatized and in normal circumstances, something most countries can't do very well, what's it going to be like when we wake up from this and find the enormous mental health needs and the regrettable and remarkable lack of ability of most countries to help people to address those needs in a humane and in a compassionate way. Now, I'll tell jokes at the end. I promise. In several languages. I'll tell them in Cantonese, Peter, just so that we'll see here if I can resonate with anybody. I see one or two people smiling, so perhaps if I switch to Cantonese, I will make people happier than the sad things I'm saying. Look, we also have to prepare for the next pandemic. Just before this pandemic broke out, 2 reports came out. One was done by Johns Hopkins and the Nuclear Threat Initiative. One was done by the Center for Strategic and International Studies in Washington. They rated all countries on a security index. My own country was rated the best at 70 out of 100. But they forgot, by the way, in the index to have a metric, to have a measurement for willingness to act. They forgot to have a measurement for a president who had no commitment, for a president who had no willingness to act, for a president who refused to lead, for a president who appointed an incompetent CDC director. So what we wound up with is, it turns out, with all due respect to my friends in the UK, the response in a number of countries was not that much better than the complete failure of a response, so-called response, by the United States. So right now we're dealing with COVID, this coronavirus, but everybody expects that tomorrow or the next day, there'll be a novel influenza, or there'll be another coronavirus, or there'll be a different emerging or re-emerging infectious disease that comes from zoonotic origin, as some of you posted. So we have to expect that the next pandemic is around the corner. We can be thankful that the measures taken to address the coronavirus have really reduced seasonal influenza. There was almost no seasonal influenza in the Southern Hemisphere, and we really had no flu season this year at all. This is good. But again, it's almost too late to prepare for the next pandemic. And every country needs to look at what they've been doing, imagine that the next pandemic is around the corner, and ensure that, building on their successes and failures from what we've been doing, they get ready for trying to ensure that their score on the Global Security Index, Health Security Index, goes from 30 to 90 and does it very quickly. This will not be easy. Another one, and this is not as immediate, and I saw that you mentioned it also, is antimicrobial resistance. So there are a few countries, and the Dutch and the Danes have been leaders, which they've done a much better job than the rest of the world in what we call stewardship of the use of antibiotics, trying to ensure that antibiotics are used rationally and not used when they're not needed, not counterfeited, not pirated, not demanded overwhelmingly by the public for viruses. There are a few, but most of the world has done very, very poorly in the stewardship of antibiotics. In addition, you have countries, very large countries, which are developing, or were until COVID, where people, as they get more and more money, they place more and more demand on healthcare practitioners, and they demand more and more antibiotics for cold, or they just go to the market where they can buy antibiotics. There was only once in 45 years of working on low-income countries where a pharmacist asked me for a prescription. And I actually gave him a gift to thank him for being the only pharmacist in 45 years who ever asked me for a prescription for drugs that I used to purchase overseas at 1/50th of the price of buying them in the United States. This is going to make antimicrobial resistance work. And as you know, in malaria, most people go to the corner store and they buy antimalarials at the kiosk, or they buy them from the local healer, the local pharmacist. The health and economic consequences of antimicrobial resistance are staggering. It costs multiples and multiples and multiples, as you know, to treat a resistant organism than to treat a susceptible organism. The drugs for treating a resistant organism are multiples and multiples of the cost of treating a susceptible organism. I think in the United States, as of a few years ago, the cost of treating, and the US is extraordinarily high priced, but the cost of treating a single person with drug-resistant tuberculosis was $250,000. It was $250,000 US. So I attended on behalf of the World Bank 30 years ago, a meeting that released a WHO report on antimicrobial resistance. Then I went to another one 20 years ago. And then I went to another one 10 years ago. And I can tell you, the world has made unbelievably small amounts of progress on this issue that could absolutely bury us by leaving us in a world which is antibiotic free. I'll send Peter a link to a very good documentary made in the US by public broadcasting called Frontline. Don't watch it before you go to sleep, but you won't go to sleep. If you watch the Frontline PBS documentary on antimicrobial resistance, you won't go to sleep, because you also know that pharmaceutical firms have done a good job with the vaccine. I agree. They've done a good job with monoclonal antibodies. I agree. But nobody wants to invest in antibiotics that you take for 2 weeks and you don't take again. And there's very, very, very little investment in the world in the kind of antibiotics needed to treat resistant drugs. So as some of you posted, this is an area about which we should lose lots of sleep. We should get really angry. We should demand much better of our policymakers, and we should ensure that mechanisms are set up to incentivize investments in these drugs, just like we incentivized investments for dealing with this pandemic. Some of you put down inequality, and inequality is both an immediate concern and a continuing and forever concern. Dealing with inequality, as you know, is central to global health. Some inequalities are across countries. A woman in Afghanistan today, the risk of dying in childbirth, that's 120 times greater than the risk of a Dutch woman dying in childbirth. An infant born in Liberia today has a risk of dying in their first year that's 15 times greater than that of a child in the Netherlands. But you also have to remember, as I'm sure you do, that in many countries, there are enormous risks within the country. We have a city in the United States that's famous for portraying inequality, in which if you live here, if you live on Central Avenue here, and you're a white male who has money, your life expectancy could be 86. If you live down here on Central Avenue, and you're an African-American male living in a poverty group, your life expectancy is likely to be 70 or 71. I think I saw a map not that long ago in which there was an 18-year gap in the life expectancy between white men and African-American men. I don't need to tell you that, and I like to use the example of saying a rich woman in Karachi, Pakistan is not going to die in childbirth. Her risk of dying in childbirth is the same as that for most of you, which is very low, happily. By contrast, a poor woman in Northwest Frontier Province, Baluchistan, still in the same country, has a risk of dying in childbirth that's probably 200 times the risk of a rich woman in Karachi. So we need to remember that we need to be concerned with gaps across countries, but we also need to be worried about and remember gaps within countries. That's hard for some Europeans to think about as much because in important parts of Europe are pretty middle class. But on the other hand, I think all of you know and understand the centrality of dealing with equality issues. And COVID has brought this out. In many countries, but the US is a terrible example of this, where our Native Americans, our African Americans, our Spanish-speaking Americans are being infected and dying at 3-4 times the rate of white Americans. There are many reasons for this, but it's a perfect manifestation of the social determinants of health. Our Native Americans tend to live in poor communities, many without access really to safe drinking water for everybody, many multi-generational homes, which make it easier to spread the virus, a lack of high quality education, which means many of them need to work outside the house, at the grocery store, or in the municipality, et cetera. So it doesn't take much to understand why, but COVID has absolutely highlighted these extraordinary gaps and extraordinary inequality. The last thing I'll say about inequality is, look, as you know, this is not going to be easy to address. Inequality is both a cause of and a symptom of issues in the health sector. But to address inequality in health, health alone won't be enough. We're going to have to address the social determinants of health. And that's not easy. You put down climate change, and I have to agree with you. There could be some winners. No one is on from Canada, but it could be that in the future, along the border with the United States, our Canadian friends might be able to grow, oranges or grapefruits, or at least summer vegetables, which they can't even grow now very well. And I'm going to be spared. My home from which I'm speaking to you is at 2,000 meters. So and there's no water. There's no water. There's the Rio Grande, which is actually not very grand. So happily for me, I might die of thirst, but I'm not going to suffer the consequences of sea level. By contrast, I told you of my deep affection for the Netherlands, and I suppose I should keep visiting the Netherlands as soon as I can, because God only knows what's going to happen to the Netherlands as the sea levels, even one big iceberg from Greenland is probably enough to take out the Netherlands and cause all my Dutch friends to want to move up here and live with me. Not to mention Bangladesh. I've been in Bangladesh 30 or 35 times. I worked on Bangladesh for many years. Bangladesh, as I'm sure all of you know, is just a delta. There's water everywhere. And as the sea level rises, it's hard to imagine what's going to happen in Bangladesh. So everybody knows we're looking at people who have more heat, some more rain, some more enteric infections and diarrhea that goes with the rain, some more parasitic infections that goes with the rain and the heat, and poor sanitation. So I think it's quite clear. It snowed in Spain last week. We had a president who would have said that proves there's no climate change. All it says is there's a difference between weather and climate. Climate change is here. It's for real. It's continuing. It's not getting better. And the potential impact on this on health is hard to decipher because there'll be one impact here and another impact there. But we need to prepare globally and individual and country-wise to deal with the many possible effects of climate change on health, some of which could be very bad for people's health. Let me end with a process issue and then just two more points. The process is enhancing international cooperation. COVID is highlighted again. COVID is we would say in American English, quintessential. COVID is the perfect example of a global health problem. Everything I've ever talked about is represented in the case of COVID. The health of anyone anywhere is the health of everyone everywhere. There's a need to cooperate across places and countries to deal with the development of diagnostics, therapeutics, and vaccines. Some countries can't afford to do what they need to do, and there's a need to cooperate to help them to do this. The evidence is emerging rapidly all over the world, and we need to cooperate to ensure that what our Tunisian friends learn, the Moroccans get to know, and we get to know, and what the British learn, we learn. And that needs to be done almost in real time. So this is the perfect storm of global health, and it's the perfect representation of a problem that reflects all things global health and the need to cooperate. Now, in the past, cooperation has produced some real wins. Some people are real skeptical of global cooperation. They now believe the WHO is the most evil organization in the world, besides maybe the Chinese government, which they think has failed to take measures in a timely way and led to all of our demise. But there have been some dramatic successes, including the near eradication of polio, the near eradication of guinea worm, the dramatic reductions in vaccine preventable illness in low and middle income countries, and of course, the eradication of smallpox. But we also know that global cooperation has worked imperfectly. And there's some real challenges to it. And some of those challenges are structural. There were delays in the world's response to Ebola. There were delays in the world's response to SARS. There were delays in the world's response to this coronavirus. And then to make it worse, we're living in an environment where there are a number of governments that have become populist and which really would rather engage in vaccine nationalism than vaccine cooperation. Rather talk about their own people as if the health of Tunisians or Romanians didn't matter, than talk about the health of all of us together. We need to quickly overcome these constraints and move somewhat back to a more cooperative environment, but we also need to do better. And I think you'll see there was an international commission on WHO, that international commission headed by Helen Clark, I think, from former Prime Minister of New Zealand, Ellen Johnson Sirleaf, the former Prime Minister of Liberia. They're going to point out some of the structural issues that we face. If you have a weak WHO with a limited budget and much of the budget tied up in trust funds that are specific, WHO is not going to be able to respond in an effective and timely and efficient way. It's not going to happen. So we need to put cooperation back in the forefront, but we also need to deal with some of the structural issues. And the sovereignty issue is a very difficult one. I think it's quite clear the Chinese did not bring to the world's attention in a timely, in as fast as they could have, what was going on. I know China very well. I speak good Cantonese, bad Mandarin. My wife is from Hong Kong. Unfortunately, China has put in jail some people who reported what they found in the early days of the virus in Wuhan. Unfortunately, China did not want the world to know about that. Now, by January, the Chinese published the genome. And at that stage, no one has an excuse for not taking the public health measures necessary. But the point I want to make is, China's not going to stop doing this tomorrow, and other countries aren't going to stop doing it either. So we need to find a way to overcome some of these sovereignty constraints. I worked as an international civil servant for 25 years. I know how to speak like a diplomat. It's very difficult, even when you're the World Bank and you have $1 billion a year to lend at cheap rates, to say to Peter, Mr. Minister, thank you very much. What an honor it is to work with your country. I admire the great talents of your country and the great progress you've made. But of course, I understand there's a new novel virus circulating in your province. And of course, I am obliged as an international civil servant today to send a note to my headquarters so that all of the world can know and understand what a bad person you are. There's a sovereignty problem. This is not going to go away. There are structural and budgetary problems. They must be solved. And the international health regulations got better, but they're not enough. Let me just end by saying, look, besides this, some of you put up two issues, which are very central to my heart and absolutely going to continue being critical challenges. In some respects, nutrition, which was one of them, could certainly be severely impacted by COVID, and I might have been wise to even add it to the most immediate impacts. But there's no issue. We're now living in a world where a large share of the world's population is malnourished. An important share of the poor are undernourished, and a large share of the rest are obese and overweight. And those exist side by side now in every country. We're now living in a world where obesity and overweight are more in numbers than undernutrition. But we also know that undernutrition leads, increases the risk of dying from measles, pneumonia, diarrhea by 35 or 40%. There is no issue. Those of you who posted this are certainly correct. Underlying all things health, if our goal is to try to ensure that all children can meet their maximum biological and psychological and psychic mental potential, nutrition is central, nutrition is central, nutrition is central. If our goal is to encourage everybody else to live as long and healthy as possible, nutrition, including on the obesity and overweight side, is central because it's so fundamental to cardiovascular disease, hypertension, cardiovascular disease, diabetes. And those of you who posted non-communicable diseases are absolutely correct. I grew up in the age of infectious diseases with fears for emerging and re-emerging diseases. But of course, it's certainly true we're living in a world today where the overwhelming majority of the burden of disease is non-communicable. We hope countries will develop, and as they develop more, their burden will become more non-communicable. It's only in the poorest countries now today that the burden of disease is predominantly communicable disease. So there is no issue, you're completely correct. It's hard to say that the burden of non-communicable diseases has been greatly worsened by COVID, but it's certainly true that if there's an enormous amount of progress that needs to be made, and COVID is going to delay further progress, and we still don't have great examples of how to deal with non-communicable diseases at a population level. So I thank you very much for your gracious invitation. Again, I'm very honored to join you today. I hope you found my comments comprehensible, understandable. I hope you think they're thoughtful, and I now am completely at your disposal for any questions you might want to raise.
All right. Well, thank you. Thank you so much for these interesting insights and this very holistic overview of these very structural challenges. I especially also liked how you kind of linked COVID to all these other underlying and structural global health challenges, and with COVID kind of being the quintessential factor exposing all these issues. So I definitely like that, and I myself have some questions, but I think, yeah, it's time to open the floor to any questions or comments that people have. You can pose them either in the chat or raise your hand if you would like to ask your question yourself. So yeah, we'll look at the right.
And my feelings will be deeply hurt if you don't ask questions.
I see a hand.
And then I won't get them jobs, Peter. And then I promise I can't help them get jobs if they don't ask questions.
Yeah, well, I immediately see people raising their hands after that comment. So yeah, I'm gonna give the floor to Marijn to ask a question. So if you could unmute yourself, maybe briefly say who you are, where you study, or what you study, so that we have some idea who we're talking to.
Yes, thank you. I'm Marijn. I'm a second year medical student at the Erasmus University. I had a question. Well, first of all, thank you for your great talk. I'm surely won't be able to sleep tonight. It's very clear that I'm not so thankful for that, but it's very clear that we are facing some enormous challenges. And I was actually wondering, what is your advice to us, to students? What can we actually do about it?
So, Marijn, my hope is not really to keep you from sleeping, but I do want to provoke you, and I do want to get you what we called riled up and excited, because I think if the world is going to effectively, efficiently, and fairly address these problems, then it's really fundamental that people like yourselves speak out about them. So you can go to medical school, you can pass your tests, you can begin to practice, you can do a residency or fellowship, you can become a specialist consultant, and you can ignore all this. Or you could participate in a group called, Medical Students for Global Health that requests a twice-a-year meeting with the Parliamentary Health Committee and tries to bring to the attention of the Parliamentary Health Committee in the Netherlands the critical issues in global health that are fundamental to the well-being not only of the people in Liberia and the Democratic Republic of Congo, but also fundamental to the well-being of people in the Netherlands and everywhere else. You can vote for people, of course, who believe deeply in some of the things that you do and that we're talking about, and you can reject people in the voting booth who don't take these things and make them a high priority. And at the end of the day, I said this when I was at Erasmus last year, at the end of the day, everything is political. Everything is political. Politics is about dividing up scarce resources, and resources are scarce even in Norway. So so what you need to do as young students is get to the politicians, get to your communities, get to your politicians, and help them make scientifically based, wise choices on the basis of the best evidence about what needs to be done to make the world a healthier place and a fairer place in ways that use money effectively and efficiently. I know you could say, Marina, Richard, that sounds pretty silly. And in some respects it is, but in some respects it's everything. Joe Biden yesterday issued 17 executive orders. Okay, he tried yesterday to basically completely overthrow and completely remake the Trump approach to COVID-19. Happily in Europe, the difference between your left and your right doesn't even matter for us. There's zero difference. Whereas the difference between, basically to be kind of madman president and a person like Biden who spent his year trying to engage in governmental services is enormous. But even within Europe, I would say, politics matters. Lobbying on how you want money divided up matters. Demanding in the UK that I'm surprised in the UK that more people in the UK really early on just didn't demand a no confidence vote in Boris Johnson. I mean, the response of the UK to the virus was extraordinarily bad, and as bad as ours. And I believe that people here really should probably be accused. They should be accused of criminal negligence. They did this willingly. So politics matters, and I think get together, organize, and at the local level and higher levels, do what you can to influence policy. At the end of the day, it's the only thing that matters. I write articles, Marin, for the local newspaper. Some people know me. I could try the New York Times. I could try the Los Angeles Times. I could try the Washington Post. But then 8 million famous people are writing to those. I write for the local newspaper every week or every other week. And it's had a real impact on the decisions of our people here and the government within the state, which I'm happy to say has had a very good approach to COVID. And then my friends take my articles and they tweet them and they put them on Facebook in the hopes that at least I can help keep my friends excited about these ideas and possibly even influence opinion more widely. You need to influence opinion. You need to influence policies. You need to influence actions. And otherwise, it doesn't really matter. It doesn't really matter. If you can't get to the people who make policy choices, it doesn't really matter, and you're going to be stuck with what you get. I hope. And again, let me say even more than I did before. I want to provoke you, but I don't want to keep you up at night. But I want to provoke you because I want you to get excited about these issues even more. I want to measure. I want Peter to do a poll and say, are you more excited about these issues than before Skolnik talked with you? If so, he can say, Richard, you did a good job. Their excitement level went from 10 to 90. You need to be excited because you need to figure out what can be done. And you need not to sit back and just let the world go on, because it's not going on in the right way, especially during this pandemic. Peter, I'm all yours for the next question.
Right. Well, thank you very much. And I actually think that was a very good answer. So thanks for the question, Marijn. All right. So for the next question, I'm going to give the floor to Jem, if I pronounced it correctly. And please correct me if I don't.
Yeah, that's correct. Yeah, Jem, thank you. So my question, first of all,
where are you, Jem? From where are you speaking?
I'm in Rotterdam right now.
Rotterdam, okay.
Yeah, this is my fake office building.
That's good. Lovely.
Thank you. Mike, first of all, thank you for the discussion. It's nice to see that you are leading such a discussion to engage more people for a fruitful
Thank you.
discussion. And my question is, as you already mentioned, this type of global challenge also triggered some more nationalistic responses from all over the world. And it also diminished the trust in government and also in global organizations such as WHO and WHO. Do you think that this is, do you also recognize this as a concern for the future, that it can even be used as a political weapon to drive certain agendas? And especially considering what's been happening in the past 5 to 10 years, politically speaking, around the world, including Europe, do you also recognize this as a concern? And what can be done about
So
this?
that's a very good question, and I think you're absolutely. I mean, you're suggesting that it is a concern, and I mean, you're asking a good question in an open way, which I very much appreciate. But your question, I think, is a very good one, and I certainly think if you were to suggest that these should be concerns, you would, in my view, be completely correct. We have stepped as a globe, we have stepped backwards in many ways. I think in some respects it's okay. Let's say if the Israelis weaponize COVID internally by trying to lead the world in the rate of vaccination, partly because Israel sees itself a certain way and wants to show the world that it's competent, but partly because Netanyahu wants to make up for the fact that Israel's initial responses in many respects were also at first good, then flawed, and they have huge social cleavages, as you may know, within Israel itself. I don't think it's okay for Donald Trump to weaponize the vaccine and say it's all for us for the reason that I mentioned, which is we're all in this together. China has completely weaponized this because, but in a nice way, probably, in the sense that Sinovac is part of China's what we call soft power. China really right now would be only so happy if everybody used the Chinese vaccine and ignored all the other vaccines. This would be the ultimate triumph of China's desire to show that it's a modern nation state with great science that will soon be the largest economy in the world. And look, China not only didn't cause the virus to happen, but more than that, China actually was the savior of the whole world. So I think to a certain extent, this is inevitable, but to a certain extent, it's completely, utterly, thoroughly reprehensible. And we need to get back to the point where the COVAXs and the joint arrangements and that we're all in this together and we're all willing to help each other takes greater precedence. This is not going to be easy, but I think that the best way to helping to make that happen will probably be successes. So like, it's going to be challenging, but Joe Biden can help unify the United States if he actually is successful in addressing vaccination in a way that Trump obviously was not. The global community, I think, can create greater feelings of good for cooperation if it turns out that COVAX, the joint initiative on the vaccine, begins to work better. It's going to be hard. A lot of things are, we say, militating against that. I think there's going to be no substitute for visible successes in a number of ways, both within countries, across countries, and globally. As those begin to happen, I think more and more people will look more favorably on the possibility of working together. I mean, I think the U.S. reentry into WHO will help, but not that much. But if it turns out that these efforts at cooperation, the Chinese don't really let the WHO group in. The International Commission issues its report and nobody pays an ounce of attention. There are no structural changes at WHO. COVAX doesn't work, nobody gets the vaccine. And within individual countries, vaccine supply constraints continue to, then I think we'll be in real trouble. And we'll continue to be set back until some major good things happen. I think your question is absolutely fundamental. I think the suggestion of your question, if I may, is completely correct. I think the only thing that will help is success after success that's visible and helps to change people's minds. There's a possibility, one last thing. So we have these COVID deniers, not just vaccine hesitancy, but COVID deniers. People on their deathbed who told the nurse, I'm dying of pneumonia, please say goodbye to my family. There's no such thing as COVID, you don't need to worry. So I think one possibly good thing is, when we're about to have we hit 400,000 deaths. That's as many as World War II in the United States, okay? As more and more people get sick and die, I'm also hoping that it will, even if it initially reduces trust in government, which messed up and made this happen, then as good stuff happens, people will become so frightened, they'll be looking for good things and more accepting. This is the world, is in a terrible state. Your question is terribly relevant. It's not going to be easy. And we need to just push, like hell, for successes to overcome each of the things that you mentioned, all of which I think are very, very prominent and in many, many countries. It's a terrible question. I wish you didn't have to ask it. And I think you're completely correct. And certainly I could have included that, but I wanted to save more of the process issues for us. But it's a very good question, which I appreciate.
Thank you very much. If I can ask a very quick follow-up question.
Please.
So what do you think of the action, for example, some of the countries, as far as I know, Canada and Australia and New Zealand, they all declared that, yes, they will acquire more vaccines that they need, but the excess of it, they will donate it to other countries who cannot afford it. Do you think there could be a sign of goodwill and a sign to the world that we need more cooperation instead of more nationalistic in-group thinking?
Yeah, no, I think this is a very good initiative. I mean, some countries, the Norwegians, the Nordic countries are famous for this, probably the Danes, the Dutch, the Nordics, have been well known for their outward look at the world and their willingness to help others. I think what the Canadians did is a good thing. And then now the US is going to join the global effort called COVAX, which is meant to create a pool of resources to try to ensure that an important share of the vaccines do go to low and middle income countries. I think all of these efforts are important. It's a good sign that the world created COVAX, but it will be a terrible sign if COVAX doesn't work. It's a good sign that the Canadians, only have 25 million people or something, have purchased enough vaccine for 10 countries. It's going to be really fundamental that work. So I think these are all good signs. They're better than the measures my own country took, but they need to be made to work. And I'm hoping that by working, they'll bring people along and remind them that there are areas that require cooperation and that can't work without them. Remember, cooperation is a necessary condition, but it's not sufficient. Cooperation doesn't matter if you don't produce results, but you can't produce results in some of these things without cooperation. So it's really a necessary but not sufficient condition. And now we have to create the sufficient as fast as we can. Okay, Peter, go ahead.
Right. Thank you very much, Jem, for your question. All right. Then I'm going to give the floor to Sinai. So please, Sinai, if you could unmute yourself.
Yes. Well, I'm a second year health sciences student, which is similar to health administration, I think, in the United States. Mm-hmm. And I'd also like to thank you, of course, for just being here and sharing your insights with us. It's been very interesting so far.
Thank you.
So I heard you speak about, the economic crisis that you mentioned that some countries were on the brink of, or maybe even already in because of this virus. And the Netherlands, on a national level, probably able to overcome that. But I have been seeing, and I think a lot of us have been seeing recently, that the discussion is growing on an individual level, because some people are in an economic crisis because they lost their business or they're losing their jobs, or a lot of students as well, because they obviously, a lot of students work at restaurants and you still have to pay tuition, but your job's gone now. Yeah, that has definitely been growing, and it has also not really helped when it comes to getting people to, go along with the policies that have been taken. So I guess my question to you is, when a country is making policies, do you think what effects do you think it's important to focus on? Do you think it's important to focus on the economic effects, or, social effects, or ethical effects? What do you think is most important to focus on?
So first I have to ask you where you got your American accent from, of course.
Oh, well, I think TV, movies, Netflix.
That's impressive.
Thank you.
I'm always embarrassed to speak before Dutch or Danish audiences because everybody speaks English better than me. but I see others also saying that's impressive. I would have thought you grew up right around the corner from me.
Oh no, Rotterdam. I grew up in Rotterdam.
That's impressive.
Thanks.
Look, Amartya Sen, who was a Nobel laureate in economics and a very famous Indian economist, philosopher, wrote a book. He's written many books about development. I joked with Professor Sen once by saying in my own book, I summarized his 600 pages in 2 paragraphs. And I'm going to summarize, his notion in 2 lines, which is what Amartya Sen suggests is that the end goal of development is to help everyone to be all that they can be in the fairest possible way. You can't guarantee that everybody's going to maximize their full potential, but you have an obligation to ensure that governments operate in a way that try to make that happen as fairly as possible for all of their people. So that's and I think for me, that's the end game of development, whether you're Liberia, or you're Norway, whether you're Guatemala or you're the Netherlands, that's what you want for your people. To achieve that, you have to worry about all 3 of the things you said, right? You have to worry about people's health and well-being. You have to worry about social issues, and you have to worry about economic. They're all intimately connected, and you have to worry about trying to ensure that what you do as a government and as a people and as individuals is always fair and ethical. So what I like to say, and with the help of a Norwegian friend, I never speak anymore about I talk about taking measures that are doable, sustainable, effective, and efficient to address critical issues in global health. But I also now never talk about them without saying fair. So what I say is what we're after is measures that are doable, sustainable, effective, efficient, and fair to make the world a healthier and better place. Let me build on that. Look, previous pandemics, even small like the plague outbreak in India, cost billions. SARS killed only about 1,800 people. It cost trillions of dollars. Mad cow killed almost nobody. It cost billions of dollars to kill all these livestock everywhere. We've known for many years that the economic consequences of emerging and reemerging infectious diseases are enormous. And yet we failed to take the measures as countries and as a globe that we needed to. Famous economist Larry Summers said a few months ago that COVID cost the United States so far $16 trillion. That means if we had spent $15,999 million in measures to stop it from coming, that it would have paid a positive rate of return. So I think what we need to do is really just wake up, both as individual countries and as a global cooperative, and say, we now understand, we shouldn't have needed this reminder, but we now understand the unbelievable importance of public health to social and economic and psychological well-being. This pandemic, which is public health in its origins, has brought the world to its knees. So first, second, and third right now, we need to ensure in the fastest and fairest ways that we become New Zealand, we become Taiwan, we become Vietnam, we become Thailand. These aren't even the richest countries. They just took the right measures. So I think all are important and all need to be in our notion of trying to achieve societies in which everyone in the fairest possible way has a chance to maximize their potential, knowing that health economic opportunities, and social well-being are intimately connected as they seek to do that. And it's not easy, but again, if I go back to Marin's point, if Marin and all of you see societies that are not paying sufficient attention to fairness, they're not paying sufficient attention to the ethics, you should be beating them up mercilessly to make them behave in those ways. There were some interesting issues here in the reopening of schools. And I think accidentally, the measures that were taken in some places to have a different approach to reopening in one place than another actually raised gigantic ethical issues, because some school systems were asking some teachers and students in the same system to bear greater risk of exposure to the virus than others. It never occurred to them. Educationists don't think about health ethics. They didn't even know what it meant. So I think you should fight to try to ensure that these goals that Professor Sen articulated can be met, and that they're met in the fairest ways. And this is where young people, whether it was Vietnam when I was a kid, or it's social inequity today, this is where people like yourselves, I think, can make a real difference.
Okay, thank you. Can I ask a really quick personal question, personal for me? Me as a health sciences student, obviously I'm gonna have to, work in the healthcare sector, whether national or international. What do you think is the best field to focus on for anyone interested in working in healthcare to eliminate those global challenges you've been talking about? What do you think people really need to focus on right now?
So let me do this. I'll send to Peter to distribute. Peter, you'll have a list of participants, right? So I have a couple of talks that I've given that talk about this. And why don't I send slide sets to Peter to share with everybody? And then if you remain unsatisfied or needing more, send me one line, and then you and I can talk, and we can take what we discuss and send it to Peter to share with the group as well. Is that okay?
Thank you. Yeah,
okay.
That's okay. Thank you.
My pleasure. Please go ahead, Peter.
Right, perfect. Right, then I'll give the floor to perhaps one more question, looking at the time as well.
Two is okay. Two is okay.
Right.
I'll be good. Go ahead.
Two more questions, that's fine. And then I'm going to recognize Lorena and Anna afterwards, if that's okay. So Lorena, please, the floor is yours.
Right, thank you, Peter. And it was a pleasure to be listening so far.
Yeah.
I guess my question is not to downplay the urgency of the COVID pandemic we're facing right now, but I want to know really what was your main global healthcare challenge before the pandemic, and how do you see it now? And perhaps, is there any challenge that you feel might be getting overshadowed or put down on the priority list because of COVID and the media attention on it that perhaps shouldn't be so?
That's a very good question. And that's why I tried at the beginning to say I'm going to frame my remarks in terms of challenges in the age of COVID. First, absolutely, COVID has pushed everything aside. I worked on the global polio program, and people used to complain polio eradication pushed everything else aside. Countries didn't have the bandwidth in their health system to do A, B, C, D, and E. So basically 4 times a year, they vaccinated the kids against polio. They made good progress, and that was kind of it, but they couldn't do more. COVID has pushed everything aside. In the media, in the popular imagination, in people's lives, it's pushed everything aside. And it's pushed aside health system development in poor countries that was making some really good progress. It's pushed vaccines aside for kids. It's pushed global polio eradication program aside. It's pushed the leprosy, elimination program aside. It's pushed aside health systems development. It's pushed everything aside. So you're completely, utterly, thoroughly correct. If it were not for COVID and you had said, what are the critical global health challenges? I would have said exactly what all of you said. I would have said, number one, the unfinished agenda of group 1 causes, communicable diseases, neonatal causes, maternal causes, and nutritional causes. These mostly affect the poor people in the world, and our number 1, number 2, and number 3 agenda in terms of making the world healthier and more fair and more equal must be to get rid of that unfinished agenda. Mm-hmm. 2 is the train is the train on the way from Amsterdam to Maastricht is already past Rotterdam. It's all the way almost to the train of non-communicable diseases. No country today has the luxury of not worrying about this. All countries must worry about it. So all countries must face the enormous burden of non-communicable diseases. They should aim to have people live as long and healthy as possible, and they should find population-based measures that as fast as possible in cost-efficient ways can address these. And of course, the easiest ways are tax the hell, pardon me, out of tobacco, do the same for alcohol, and then start figuring out ways of causing people to change their dietary habits, which is not very easy. But then the third would have been emerging and re-emerging infectious diseases, antimicrobial resistance, and of course, the quest for universal health coverage. So I would have said, in some respects, you could say, and I like to begin with the unfinished agenda because it's unfinished. It says we can't, it's great. When I was your age, 30 million kids under 5 died every year. It's great. Only 5 million children die every year before their 5th birthday. 4.9 million of those children shouldn't die before their 5th birthday, right? This should never happen. So for me, I think we still have to say the unfinished agenda. But if you want, you could put universal health coverage second, and then go to non-communicable diseases, emerging and re-emerging infectious diseases, antimicrobial resistance. That would keep us all busy for a long time. And I think and climate change and even the longer run. So I think the comments that you all put are completely consistent with the talk I have on critical issues in global health that doesn't mention COVID. I think you're completely correct. And that's what I would say.
Great. No, that's very helpful. I guess we're looking at everything through the lenses of the COVID pandemic, but I hope those issues remain a priority in the agenda in the coming years.
And I think you all have to fight to be sure that they don't get lost. Again, I framed my talk this way because of the centrality of COVID, but I can come back for the other talk later. If you don't have a bleeding ulcer or a headache already from me, I can come back and do another talk later. Peter, right, I think we have time for one more if you want.
Right. Well,
my pleasure.
Perfect. Thank you very much. So on it, then I'm going to give the floor to you, and then go ahead.
Well, thank you too for your talk. It was insightful, and I think we all learned something from it. And you also talked about how you write articles locally. And that is something I would like to ask a question about the role of journalists and what you think of the information that is being provided as of now in the world, but also in local news providers. Also looking at, you mentioned these conspiracy theories, you could say, and also people who are themselves setting up information channels on YouTube, for example, or other channels. And I'm curious what you would say to journalists on which people should journalists talk to, and maybe a little bit what should they ask, because sometimes people say, well, only this. You have a lot of responses from people on journalism. So actually it's 2 questions. How do you look at the information that's being provided, and what tips or something would you give to journalists about covering the topic of COVID-19 and the health?
I think, when it comes to global health or COVID-19 or both, communications are unbelievably important. And that means communications at all levels. Governments, everything we know about public health says governments need to communicate clear and consistent messages. My own was a miserable failure at that at the national level, and that really contributed to the divisiveness within American society and the failure of America to respond to the pandemic. One is governments need, whether it's HIV, it's TB, it's malaria, it's maternal health, they need to be consistent and clear and simple and scientific in their messaging. 2 is the public media need to, of course, in principle, do the same thing. And yet, what we know is if there's a single death tomorrow of somebody who got vaccinated that day, that's the only thing we're going to read about from a journalist who doesn't know or doesn't want to know that on a single day in that community, X number of people were going to die, whether they got the vaccine or not. And after careful attention, it turns out that person's death, that heart attack had nothing to do, for example, with the vaccine. I think we need to go back to the notion of, I think we should be pushing for greater professionalism in journalism. And that means, journalists tend to think they know everything about everything. They're like lawyers or like some of the scientists I know. They don't know everything about everything. I think we need to be encouraging some of the foundations and other to try to create, especially in the world of misinformation, a cadre of journalists who get better and better at dealing with scientific facts, understanding them and articulating them in simple, clear ways to the public, rather than presuming that tomorrow you can write about crime in Amsterdam and the next day you can write about, the coronavirus. And the three is, I think we have a real challenge in the world, which the Europeans might be a little bit better at dealing with social media. And I'm being quick because unfortunately, my wife needed unexpected medical attention, and in a couple of seconds we're going to run off, but I can come back to you with a fuller response. So, dealing with Twitter, dealing with Facebook is a difficult issue. Personally, I don't think it's defensible for social media to allow itself to be used for what is clearly contrary to fact. I don't, there was a Holocaust. I don't think it's okay for social media to be used as a platform for Holocaust denial. I don't think it's useful or helpful to be used for promoting vaccine hesitancy. On the other hand, I admit, this is a very difficult issue. I wish they could find a line that would allow us to continue maintaining freedom of speech to the maximum, but at the same time, that would allow social media organizations to feel comfortable that they have a clear-cut line. They had one for the promotion of violence, but they don't have one as clear. These are very difficult issues, but I think and the last one is train scientists like crazy. So my friend Peter Hotez, who you might see on CBS, CNN or PBS and other things, he's at Baylor University. He's one of the leading spokespeople on COVID. Peter is a brilliant communicator. He's an MD, PhD scientist of the highest caliber. He's written a popular bestseller about his daughter's struggle with autism and whether this has anything to do with vaccines. We need to be training journalists. We need to be training scientists. It's not okay to have a scientific discovery and not be able to articulate in clear, simple terms to the public what that means for treatment for COVID. Either you need to be able to articulate your discovery, or in your lab you need to be able, or in your university. So I think your point is a really fundamental one. And within countries and across countries, we need to do much, much better at reminding ourselves of the centrality of communications and trying to create better structures for training people who can deal with these issues, understand them, and articulate them in popular ways. And then I really think we just have a terrible struggle now thinking about the conflict between freedom of speech and the dissemination of very harmful information that's not science-based. Your answer deserves a better response. And unfortunately, what I'll try to do is maybe formulate one and send it to Peter to share. But it's a very, very critical issue, and I appreciate your asking it. Peter, I think that's all. This has been great fun, and I can't thank you enough for honoring me with this wonderful invitation. I wish that I could get to know each of the participants more fully. If any of you think I can be helpful to your thinking about global health or the group thinks, I have lots of slide sets, I have lots of presentations, I've got some videos, I have friends whose work I would refer you to, and I'm always very happy. Nothing would make me happier than to see you fulfill your global health dreams and to also go out and do what you can to make both your individual countries and the world a much better place. So I'm very grateful to you, Peter, and I hope this has met your aims. And I do hope you'll sleep at night, but I hope you'll be excited enough that you'll all go out feeling even stronger than you did before about trying to make the world a better place.
All right. Well, thank you very much. And I'm very sure that this has definitely happened, that people will leave this meeting with more awareness definitely about these issues that you've talked about. So yeah, on behalf of the Honors Association and myself, I would like to thank you very much for the interesting insights you provided during tonight's discussion, and for your enthusiasm and cooperation in making this event happen. So yeah, we really appreciate it, and we were honored to have you.
Thank you. I look forward to being in touch.
All right, thank you very much.
Thank you very much, everyone. Bye-bye now.
Thank you so much.
All right, yeah, I think Mr. Skolnik has left. Yeah, Mr. Skolnik informed me in the beginning that he had to leave at 1 p.m., which is 8 hours later, 9 p.m. for us. So yeah, I also wanted to use this moment to give special thanks to our active members, Sikun, Sinai, and Marijn, for their efforts in making this event happen. So thank you for that, and many thanks for all the participants who joined tonight's event and asked all these interesting questions. If you're interested in more events like this, the Honors Association is planning to organize more events in the future that challenge students to think critically about these complex issues like we did tonight. So make sure to follow our social media accounts on LinkedIn, Instagram, and Facebook, and check our website to stay up to date for these future events. Once again, a big thank you from me and the rest of the board to everyone who was here, and especially to Mr. Skolnik, who had to leave a bit early. As always, stay safe, stay healthy, and enjoy the rest of your evenings, afternoons, or mornings. All right, goodbye.
Thank you. Ciao, ciao.
Great evening.
Thanks.
Thank you.
Bye.
Bye.
Thank you.
Nice evening.